Hey everyone, Dr. Joe here with Barefoot Rehab, New Jersey's first and only non-surgical neck and upper back soft tissue specialist. I see a lot of patients come into the office and they say, Dr. Joe, I have shoulder pain, I have scapular pain, and also I have a problem dropping my shoulders, meaning they tend to be like this with their shoulders elevated and they have a hard time dropping their shoulders. They've gone to traditional chiropractic, they've gone to traditional physical therapists, they've gotten massage therapy. The relief only lasts anywhere between 28 to 48 hours. An experienced manual adhesion removal specialist like myself will be able to find the cause of this problem using only our hands and afford to give you the permanent relief that you're desperately seeking. A lot of times the cause of this, especially this mid-scapular pain, the shoulder pain and the shoulders being elevated, is due to a nerve called your spinal accessory nerve, which is about the size of a piece of linguine that runs through our upper trap muscle. Everyone knows this muscle right here, okay? And runs down the trap into a muscle in our mid-back called our rhomboid. Now, when there's adhesion between the spinal accessory nerve and the upper trap, the nerve is going to cause that upper trap to almost go into a small spasm. And a lot of times when that happens, the trap becomes elevated like this. And this is why a massage therapist can work on it, but you don't have the ability to drop it. Somebody like myself who uses our hands to find the adhesion, remove the adhesion, will be able to provide you with the permanent relief that you're looking for. One way to determine if you have adhesion in your spinal accessory nerve is to do a cervical thoracic flexion test. Our beautiful patient, Sheb, who's also in a lot of pain, has discomfort into that area here. We see on her test that she has a decreased range of motion. We're going to now treat Sheb's spinal accessory nerve and retest to see how much improvement we make on her cervical thoracic flexion test. Okay, so what I'm feeling for here is I'm feeling for the accessory nerve. The spinal accessory nerve feels like a little piece of linguine along the upper trap muscle, and we're going to trace it as it comes down into the rhomboid muscle. A lot of times when a patient has shoulder pain, mid-scapular pain, or they feel that their shoulders are elevated and they can't relax their shoulders, it's because this nerve, there's adhesion at the nerve and the upper trap or the rhomboid. What we're going to do now is, as I'm palpating along that little piece of linguine, I'm feeling that this side right here is not moving the same as it's moving on the right side. So we're going to take depth and tension, and as I'm taking my tension, I'm feeling for the adhesion to pull tight like a rubber band. As it's pulling tight, we're going to move the patient's head into flexion, tearing the adhesion, helping create permanent relief. Good, come back. I'm going to do 2 more passes here. Again, I'm rechecking and I'm feeling for how compressible that area that was just stuck is now. Should be doing okay? Mm-hmm. Go Tracy. Good. One more. So I'm feeling the adhesion pulling tight, and as she's flexing her head, we're driving through the adhesion. Very good.